This is working. This is Delaware State Representative Paul Baumbach, serving the 23rd House District in the west and north side of Newark into Pike Creek. And it is, what are we at here? Saturday, February 11th, 2023, a little bit after 4 p.m. Making sure it seems like, there we go. It looks like we're live. Okay, good. So I'm here to talk about the the current and upcoming changes to the Delaware retired employees' health benefits, where we've come from, where we're at, and where we're going. This is the third of these Facebook Lives that I'm offering. And this one, I want to have my comments be pretty brief, and I'd like to strive to spend time reviewing comments, fielding questions with answers if I can, and going from there. So let's sort of go through history. The state has obviously had state employees for centuries, and we have provided healthcare benefits for our current employees and for our employees once they retire, as long as they've been working for the state for a number of years, for decades and decades. We have pretty much a pay-as-you-go program, so that when retirees, people are working for the state, we have not regularly set money aside for their benefits that will be due when they're retired. So we wait until they're retired, and then when they have health costs that the state's responsible for, the state just pays it out of that year's budget. And that's been operating sort of fine for quite a while. There are accounting rules that have changed in our country in the past 5 years, and that obligation, that unfunded obligation, is one where it's now becoming visible. So that was I'm going to say it's an unfunded obligation that was largely invisible to the reporting of the state's finances for decades, and that's changed recently. So it's quantified by a profession called actuaries. They do all the number crunching. They say, oh, we've got so many tens of thousands of retirees, and they're likely to have this kind of annual out-of-pocket cost, or not out-of-pocket, but promised benefits that the state's responsible for over the next few years. It's going to cost this. And the problem is that figure over the next 30 years is counted in the billions of dollars level. And our saving money towards that pales in comparison. So we've known about this the state has known about this for decades. The accounting rules, again, changed in the past 5 years and is much more visible, so that we in the state have finally come to a point of saying we want to see what it takes to address this in a responsible way. This is something that has built up over decades. It is not something that will be fixed overnight. It is something that will take decades to address. So that's very high level. There is a committee within state government called the State Employee Benefits Committee, the SEBC. They are responsible for much more than just retiree health care. They're responsible for what current employees get, for health care, for vacation, for everything, but also retirees' pension. Well, there's a pension board, but retiree health care is under the SEBC. There's an executive order that Governor Carney signed, which sets up the Retirement Benefit Study Committee that is has been tasked with reviewing the issues, I'll say the problem, coming up with recommendations how best to address it, and to come out with recommendations to the SEBC. They did so in 2020. They started, I think, in 2020. They did a lot of work in 2021, early 2022. Their second revised set of recommendations went to the SEBC, and one of those recommendations was to substantially change the retiree health benefit to go from, I will say, a traditional Medigap program above traditional Medicare, and to change it to what's known as Medicare Advantage, which is it's another system of retiree health care, but it is different in some substantial ways that, frankly, I don't want to get into this moment. But regardless, that was the recommendation. The SEBC accepted that, put it out to bid, found a winning bidder, and as of June 1st was notifying retirees that changes would happen in the fall, effective January of 2023. The more that was learned about it, the more concern was raised in August, especially the alarm was raised very high and loudly. A lawsuit was filed against the state by a group called RISE, statewide group of really retirees named RISE, and a Superior Court judge issued really a stay prohibiting the state from proceeding with that, and instead ordered the state to keep the current Medigap program for calendar 2023. It's been in limbo as that decision is being reviewed at higher levels within the judiciary. By the way, my cat is here, which is what the heck I'm doing here on my right side. You may see it as the left. So while that was happening, there was some legislative efforts to come up with some adjustments. And that was created in October, but that's when the judge's order came through. So that was stopped. That General Assembly ended on Election Day of 2022 in November. We have a new legislature that came in. We began session the second Tuesday of January, and we had a piece of legislation called Senate Bill 29 that made some modifications intended to help on transparency and to really broaden the responsibility from primarily the executive branch and to create a much more significant role for the legislature in there and, frankly, the public. So that's what Senate Bill 29 was designed to do. It was passed in January, signed by the governor into law also in January. It has not yet met, but that part of that's because there are appointments needed to fill the changed. We no longer, we have the RBHC, Retirement Benefit Study SC, but it's really gone away and being replaced by the new advisory subcommittee. And that has not yet met, but that should happen. I'm hoping by the end of this month, the end of February. All these things are public meetings. They'll be announced once we know when meetings are, but we, again, need to start with figuring out who's on it. We know that it is chaired by Lieutenant Governor Bethany Hall Long. She also teaches nursing at University of Delaware, so she's got a good intersection of experiences to bring to that. It will be co-chaired by a member of the Senate Majority Caucus and the House Majority Caucus. It's expected that's going to be Senate Majority Leader Senator Brian Townsend, and on the House side, myself. I was named in December to the RBSC, but that's largely defunct at this point. We will also have a member from the House Republicans and from the Senate Republicans. But there's also other members on that, and their appointments they're being named is coming any day now. There's also some that are there because of their current office, cabinet secretaries, as an example. So with that, and David, I'll get to your point in just a second. It's a very good point. I want to jump over and show you Senate Bill 29, and you should be able to see. There we go. So the SEBC, anything that's not underlined was what was already law before January. And what's underlined are some changes. In some cases, it's just punctuation, so we can sort of ignore that kind of stuff. So I'm going to scroll down. I'm going to go over here and scroll down. There we go. So we get to the underlined part. Sorry, I should say. So who's on it? We've got Lieutenant Governor, the Insurance Commissioner, Chief Justice of the Supreme Court, State Treasurer, and none of them answer to the governor. So Lieutenant Governor is independently elected, as is the Insurance Commissioner, as is the Treasurer. Chief Justice is appointed by the governor. It needs confirmation by the Senate, but really at that point no longer answers to the governor. I think that's largely accurate. Then anytime you see director or secretary, those are cabinet secretaries, and they are named by the governor, serve at the pleasure of the governor. So Director of Office of Management and Budget, Controller General. Actually, Controller General is independent. largely independent, works for the legislature as a really an impartial reviewer of all things financial, so that we have someone independent from the governor's office to help us with all budgetary matters. Cabinet Secretary from Human Resources, the Cabinet Secretary for Health and Social Services, and then some designees. So the governor now will be appointing one state retiree, and in addition, two additional members. Let me say, in addition, the governor shall appoint two committee members. One appointed. Oh no, sorry, the governor's out of there. In addition, there's two committee members who are appointed, one by the President Pro Tem of the Senate, who is Senator Sokola, one by the Speaker of the House, who's Representative Schwarzkopf, and they're from amongst the following organizations of current or retired employees: DSEA, the Association of Teachers and other professional educators, also from ASME, the American Federation of State and County Municipal Employees, and then also Correctional Officers Association. So that those are the workers in our correctional facilities, and also DSTA, which is the State Troopers Association. So from those four organizations, two must be selected, one by Senator Sokola, one by Speaker Schwarzkopf. And then, let me see, so then we've got some terms. So that's for the SCBC. So we ended up with having one retiree appointed by the governor without any really more restrictions of more specifications, requirements of where they come from, but again, by the governor. Then one each by the Speaker and the President Pro Tem. And it points out that it's someone who is there because of their office, such as the treasurer or such as the Secretary of Human Resources, must meet themselves. They may not use a designee to count as attendance at a meeting. Let's see what else. And this is chaired by the Secretary of the Office of Management and Budget and the Secretary of Human Resources. So those both report to the governor. So the SCBC has had, with Senate Bill 29, was changed a little bit, broadened it a little bit, not, I'll say, dramatically. But what was more important, you got to go way down to get to the next sort of underlined section, because nothing's being changed in any of these lines that aren't underlined, is you go down to 9604. So this is the new subcommittee, and this really functionally replaces the RBSC. It's the Retiree Healthcare Benefits Advisory Subcommittee. And it has some of the same people: Lieutenant Governor, Insurance Commissioner, Secretary of Office of Management and Budget, Secretary of Finance, Secretary of Human Resources, four legislators, one from each of the four caucuses, and let's see, one member. We got that, sorry. And then the governor shall appoint one retired state employee from each county and one representative of the Union of State Employees, and the Speaker shall appoint one, and the President Pro Tem another representative of unions of state employees. So that's the membership. But importantly, I want to point out that the leadership, so the leaders of the SCBC are two cabinet secretaries who serve on the governor's cabinet. This is chaired by the lieutenant governor, and the co-chairs are the appointed members from the two majority caucuses. So Senator Townsend and myself, we believe, will be the co-chairs. So this study, the advisory subcommittee, is one that has a different makeup, and so, but it has a very similar charge. And so let's go down and say, what is it supposed to be doing? We can skip that stuff. I should say this bill has an awful lot of whereas clauses, and it says a whole bunch of stuff. To me, that really is, it's wrapping on the president. What matters is what's inside the box. What's inside the box is what I'm showing you here. What is this? What are the powers, duties, and functions? So we do public meetings, receive public comment about current and future state retiree healthcare benefits, including previously proposed Medicare Advantage, but also taking into account other things. And it's going to review all the work of the SCBC and the RBSC in this regard. But in addition, it's going to look at, for instance, how Medicare Advantage has worked in the past for others. And we know over the past 6 months, some of the very serious, I'll say, indictments. I don't mean that in a legal term, but accusations and reports of how Medicare Advantage has disadvantaged some of its enrollees in many not in some, in a lot of cases across the country over the past several years. And it'll look at other implications of the existing Medicfill, the supplement plan that we currently have. And we're looking to say, what would it take to extend Medicfill to and beyond January 1st of next year? Look at options for continuing this provision of healthcare to our retirees in a fiscally sustainable way. In other words, sure, it'd be nice to keep doing it exactly the way we're doing it, but we've got this $9 billion hole that we need to address. So the advisory subcommittee is looking at how this can be done. By May 1st of this year, which is just what we have less than 3 months away, come up with findings, recommendations. I view this as really, it's a status update to the governor, the General Assembly, and of course, all that's going to be public by May 1st. And the reason we do that is, the reason that this is a requirement is to the extent that there's anything that needs to go into the upcoming budget that would begin on July 1st, we want to make sure that the advisory subcommittee gets those recommendations out as it's able to by May 1st. And that's the end of the bill. So it is not to rubber stamp. It is not to look solely at Medicare Advantage. To tell you the truth, this looks like it may, no, I think it must have the inclusion, but it looks beyond Medicare Advantage, certainly. So that's what that does. I'm going to go to 2 quick slides, then we'll get to questions. So this is from presentation. Governor Carney presented the last Thursday of January. I think that was last Thursday, third Thursday. Anyway, and it talks about what we're doing for our workforce, almost $200 million for current employees and retirees for healthcare. Obviously, that's a lot of dollars, and that's fulfilling our obligations. And 143 million of that is, keep in mind, the current Medicfill, our retirees get healthcare first through Medicare, and what it doesn't cover and is covered by the Medicfill pays, but really it doesn't pay. It charges the state, and the state pays. So both for current retirees and for retired employees, the state's paying is projecting to pay 143 million in the next fiscal year, from July 1st of this year to June 30th of next year. And in addition, 51 million, so that's 1% of the budget, which is a $5 billion budget. So another 50 million, as we did last year, is proposed by the governor to go into this fund that has been neglected for decades. And this is part of a plan of one of many different steps in order to address the shortfall. And one of those steps is this 1% of the budget from now on, I'll say next 30 years, likely, of putting 1% of the budget towards this fund. OPEB is other post-employment benefits. So this is we've got, the liabilities are, $10 billion. That fund for it is, certainly less than 1. So we're adding over $50 million next year towards that. And then the last one, is that the one? Right. So we're short. The liability is about, at this point, is about almost $9 billion, and we've got less than $500 million set aside for it. And it's only projected to get bigger and bigger in the next 20 years. I want to go to slide 9. I know that you can view it as, sorry, let me back up. This is a presentation by the governor's administration to the legislature, to the different caucuses last month. It points out that in order to address the gap, there are 3 clear pathways to get there. And it's not that, I view this as a Chinese menu. We've got column A, column B, and column C. And it's not that you can only order out of one column, but rather you can do a combination. As a matter of fact, for the current year, what was proposed last year and was stopped by the judge, was to have that 1% set aside, that $50 million or so set aside. That's on the taxpayers, because that's out of the general budget. And then the middle column of current and future retirees was a switch to Medicare Advantage. And we really didn't make any changes to active employees in any meaningful way last year in the recommendations from the SCBC and their actions. So it was using column A and column B, and truly, these are the three choices, and we can choose multiple things from each column of how we can address the shortfall. So those are the pieces from which the advisory subcommittee will be exploring, learning about the different choices, and perhaps exploring some additional ones, and identifying which ones are the best combination to address this. That's the stuff I wanted to bring up first, and now I'd like to go directly to your questions. So, start off, David. This is back when I was talking about we've been ignoring this obligation to our future retirees and just paying as we go. But it means that as we have retirees and they have health costs come up, we've not had money set aside in any meaningful way for that. And Dave points out that's what private companies have done, have been required to do for many years. This keeping it quiet, keeping it off the balance sheet, is something that I think FASB is the Financial Advisory Standards Board. They rule how CPAs report both for-profit, non-profit, state government accounting statements, and the private companies and the public companies were required to have this kind of reporting for quite a while. This has been pretty new for state governments. How many state retirees will be on the committee? Nancy asked that. It depends which committee we're talking about. So let's go back to that. And let's go to SB 29. So the SCBC itself just has one appointed by the governor. So let's go up and see if we can see that one. There we go. So if I remember that correctly, do I remember that correctly? Right. So I'm going to go to the top of the screen. You can see at the end of the first line, one state retiree appointed by the governor. And then in addition, we have two new people in the SCBC who come from organizations. And these are organizations of really of current state employees, teachers, state police officers, workers in our correctional institutions, and those who work at state county and locality and municipal government. So they may work for sets of employees who, for instance, work for Newcastle County and for the city of Newport and for Smyrna and for Rehoboth Beach and all that. So many different levels, but these are really current organizations for current employees. You asked how many retirees. One retiree on SCBC appointed by the governor with no additional restrictions. There used to be, I think, two from the organizations in the past, but this now puts that responsibility onto the Senator Sokola and Speaker Schwarzkopf. And now if we go to the News Advisory Subcommittee, what we have there. Okay, so here we've got a number of retirees. So I'm going to go back here. The governor shall appoint one retired state employee from each county. So three members of this new subcommittee of just retired state employees, one from each county. These are appointed by the governor. Also, the governor appoints one representative of a union of state employees, as does Speaker Schwarzkopf and as does Senator Pro Tem Sokola. So we've got three retired state employees and three representatives of state employee organizations. So 6 people from current and retired state employee, either state employee or state retired organization, state employee organizations on this advisory subcommittee. Okay, I'm going to go one question at a time. What's the legal basis for the judge stopping the switch in retiree medical plans? David, that's a great question. I didn't mean to laugh. It's a great question. And my understanding of the answer, let me lead by saying I'm not an attorney. But I think that the argument that Rise made that the justice leaned on in his ruling was that the changes that the SCBC made to the retiree health plan, going from a supplement to a different version of a Medicare benefit plan to Medicare Advantage, is not something that was a directed power of the it's not the right term, but legislated power given by the legislature to the SABC, and rather it was more of a regulation. And while they went through public meeting practices and open for comments and all that sort of stuff, they didn't go through it. They didn't treat it as a regulation. Regulations, putting in new regulations, have a set of procedures that have to be followed. I think it's the Administrative Procedures Act, the APA. And that includes things like putting this out into the monthly registry of proposed new regulations with a 60-day window of public comment. And they didn't go through that process. They didn't view it as a regulatory change. They viewed it as an administrative action. So I believe that that was the basis of the judge ordering the stop of the move as of January 1st of this year into Medicare Advantage. Was the short brought on by the COVID volume of opt for early retiree for age appropriate? Was the short, so Jennifer, I'm trying to understand this, brought on by COVID volume of opt-in for early retirement of age appropriate? Was the shortfall, I imagine, brought on by people who retired early due to COVID? I think that's your question. Jennifer, another very good question. And the answer is no. Sorry, I'm going to get back so you get to see my smiling face. This shortfall has been growing and growing well before COVID came in, and would have happened. We would be facing this whether or not COVID happened in the past three plus years. So we can't lay it at the feet of COVID. Joan, as many people have already noted, 3 months isn't a long time in which to do a good job of something this complicated, and yet something has to be done in time for the budget discussions. An obvious possibility would be to recommend remaining on the current plan during 2024, after which whatever changes agreed upon would go into effect. Is there any reason that that would not be possible? Joan, I gotta say every question here has been excellent. And Joan, your question of, yes, we're being called in this advisory subcommittee to share a recommendation by May 1st, which is less than 3 months away. And that seems pretty darn short to dig in as deep as is being requested for this very significant move. And is it possible for us to punt another 12 months? And by punt, I don't mean in any judgmental way, but to recommend no change for one more year. And to give us 12 more months to dig fully, and then to have time to put out for RFP and to communicate with our retirees the coming change, whatever change we have. Is there any reason that would not be possible? The answer to that is a clear no. There is no reason why that would not be possible. Restated, yes, that is possible. And I know that there were many things that have been raised in the past 6 months of, well, can't we grandfather people? Can't we make it so that we keep offering the medic fill, but have a cost share with retirees for some of that, so that 170 million or something the state has to put in, is that so it's lessened. All those possibilities are within the scope of that advisory subcommittee, and so everything in my mind is on the table. And I hope and trust that every member of that subcommittee also views everything as being belonging on the table and should be considered and given its full consideration. And wow, I just fed into Kathy's. Is there any talk about grandfathering those retirees who want to keep their medic fill program? So let me say, is there any official talk on that? Absolutely no. Why is that? Because the new advisory subcommittee hasn't formed yet, hasn't met yet. Has there been talk out in public about this? Yes. Was there talk in the forums in August, September, October? Yes. Would I expect that most of the subcommittee members already know that as being a request that has been made of retirees? Yes. Do I think it's on the table? Yes. Let me share another thing. So I'm going to pretend that I'm just posing the question, like you are. Can the legislature? So I'm sorry. Let me back up. One of the frustration. I had a lot of frustrations about the path that we've gone on, but that's in the past. I want to look out the windshield, not the rearview mirror. But one of my frustrations was that there were some recommendations made by the RBSC, which were not taken up by the SEBC. I love these initials. And so I've heard the concern of, well, what if this advisory subcommittee, is this a sham? Can the subcommittee make these great recommendations and say, you should do this, you should grandfather, you should have this option, you should do this or that, and the other thing? And the SEBC says, thanks for your recommendation. We're going to ignore it and do what we want to do in the first place. Structurally, is that possible? Absolutely, yes. Okay, now breathe, breathe, breathe. Structurally, frankly, can anyone in the legislature, but let's say, can the four legislators, let's say that in our meetings, we find that there is a clear path or set of paths that we think are absolutely the way we should go. And let's say this is the advisory subcommittee, but also these four legislators, one from each, both Democrats, both Republicans, both senators, both representatives. Let's say to us, it's clear that there's a set of paths that make sense, and there's a set of paths that make very bad sense, and we don't want that. We will have four voices on that committee. We're co-chairs. Hopefully we can get a majority of the subcommittee to include that in the recommendations to the SEBC. But what else can we do? We're lawmakers. We can make laws. So what can we do? We can end up anytime, but let's say between May 1st and June 30th, we can have a law that says to the SEBC, you are not allowed to do X, Y, and Z. And in your choices, you must do something within A, B, and C. One of those may be, you may not change state retiree health care for calendar 2024. Okay, if that is something that the four legislators feel strongly about, and we have enough majority of each of the two chambers to pass, we can absolutely do that between May 1st and June 30th. And even though this subcommittee only makes recommendations to the SEBC, we can tie the hands of the SEBC by passing a law. We have that ability as lawmakers. But let me remind you of your Schoolhouse Rock. The governor can veto things. So we need to make sure either we're working with the governor and the governor concurs, or we work with our legislators to make sure we have a veto-proof level on that. So realize both the limitations and the strengths of the structure. The limitations are that, of course, I'm focusing on the subcommittee because I serve on the subcommittee, or I expect to be serving on the subcommittee. So I think we've got good voices on that subcommittee, and I'm confident. I'm confident in the Lieutenant Governor. I'm confident in Senator Towns and myself, and our colleagues will be on this, and with the other members of the subcommittee, that we're going to be looking at everything. We're going to be considering everything, and so I believe in that process, and I believe that when we're ready to make recommendations, we'll make them. We'll give an update as required by May 1st. Maybe it'll be a full set of recommendations. Maybe the recommendation is we can't do anything until next year, so give us 12 more months, or 9 more months or something. I have confidence that will do good stuff, and I think that I'm expecting to be proud of what the subcommittee recommends. It is purely a recommendation, goes to the SEBC. The SEBC is more controlled by members of the administration, and that's its structure, because we legislate, and the executive branch executes, and so it's the people who are executing it who are the leaders of the SEBC. Structurally, that's the right thing, but there can be times where, as legislators, both for policy and frankly for constituent reasons, we want to do some direction of the executive branch, and for that we pass laws. Structurally, we need to get past a veto if the governor does not agree with a law that we pass, or I should say a bill that we pass. It doesn't become law until he signs it or until we override a veto. So I think we've got a good structure. We've got an advisory subcommittee that I think is going to do good work that you can follow. I want you to follow. I want you to speak up. I want you, to be involved, and much more so than happened over the past 2 years up until July, August, we'll say, and make recommendations to the SEBC, as it should. I do know many of the people in the SEBC, and I think that they're, hardworking and good intentioned. But I also know that there's, additional pressures coming from different directions on them. I I think that there can be things that legislators may look at and say, um, we need to go beyond a recommendation to the SABC. And I know that there have been legislators in the past 6 months who have called for legislative action to make some constraints on the SABC and its actions, and we haven't acted on that other than SB 29 with an extra member or two on the SABC. Um, but it wouldn't surprise me if we end up with, and frankly, we've seen some bills floated by just in January by some members. But I think it's best to give this advisory subcommittee some time to meet publicly, start exploring things, and see if there's a certain direction to go. And then we can figure out, we've got time before next January 1st to see if we feel that there's a legislative step that's needed in order to put any direction, guidance, requirements on the SABC and how it does the rest of its job for 2024 and beyond. I'm not seeing more questions. Oh, they were good. And possibilities have to be on the table. And respectfully explored, Joan, I cannot agree with you more. Find enough time to do that well. Yes, I agree. Well, there's times I'd say the cat isn't my favorite, usually when he's walking across me at 3 a.m. But otherwise, he's a very nice cat. By the way, I do share this on YouTube because I do realize that not everyone spends their life on Facebook, and frankly, I'm envious of those people. But I want to thank you for being on. I am going out of town for a bit, so I probably won't be doing this for another 3 weeks or so. But anytime there is news about this advisory subcommittee, including when there's meetings and such, and I'm sorry, time to show my screen again because I had something else I want to show you. I go there and I go there. Okay, you can go to Google and you can type Delaware Public Meeting Calendar. And you can say, hey, I want to know about the public meetings. And you know what? I want to know about, let me think here for a second, how about the SABC? And I want to figure out, what do I want to figure out? Can I do that? How to do that? Let's view, calendar view. That's fine. So let's just do a search. Yeah, I don't want to do that. So let's say I want to look at from 2022 through 12 of 2023 and search for that. So I see, and it goes for the most in the future to the least in the future. So the SABC itself, I'm going to go down towards the bottom. February 13th, it just had its subcommittee just met. Sorry, 13th sounds like it's Monday. So Monday at 1 o'clock, the health subcommittee meets. 10 a.m. on Monday, the financial subcommittee meets. And then the full SABC meets the following Monday, I believe that is, at 2 p.m. And both you can go in person or you can go virtually. So you can click on this and get more information. Interestingly, so let's go and look at the finance subcommittee. Let's see, let's just try that guy there. One nice thing about it, other than it not, there we go, is you can see what are the documents that are going to be presented at this financial subcommittee. Okay. Now, this only goes up a few days before the meeting, most often, or sometimes it gets updated. So let's see what are the things it's looking for. So it's got its agenda, and that includes how to join it by Teams in case you want to join it from home or from work. And it gives you the minutes of the last meeting, who was in attendance, including the subcommittee members themselves. And then these are the minutes. It then shows you the health fund and a whole bunch of numbers, because you remember, this is the finance subcommittee. And then we do a cost analysis of both medical and prescription costs. And we look at it. So it goes through numbers. It's a finance subcommittee. So that material is right there through that public meeting calendar. And then if I go back there, you can see the agenda also. So starting on Monday or Tuesday, you should be able to find the agenda for the, I don't know why it's doing that one, wow, that's really not a happy camper. But you'll be able to put in, there we go, I know what we'll do. We'll look at a here we can look through and say the SABC, my guess is they don't have documents yet. I would expect by Monday, you'll see the agenda and a preliminary piece of documents, but you may want to keep checking back in case they update that. So that's, I think, useful. And what I was getting at is, and sorry, let's go further. This is the SABC's page, and you can again Google search to get there, and you'll see all of its agendas and all of its past ones, and be able to look up all the different data presentations and all they had, and you have the same level of information on the Retirement Benefits Study Committee. So that information's out there. And then here's what I wanted to get at. When the Retirement Health Benefits Advisory Subcommittee, I think that's what it stands for, what its words are, as soon as I know of meetings announced, the next meeting and the first meeting announced, I will let you know. I'll be doing it on Facebook. I'll probably be doing an email blast. And I apologize for those very sane people who are not on Facebook. But those are the two avenues I have. So I'll be using that. Share it. Certainly, let me say, I've made promises when I accept this appointment to the RBSC and expect to receive the appointment to the new advisory subcommittee. I'm promising my colleagues to keep them in the loop. So that means the House Democrats, I'm responsible to them to be their conduit, to get information to them and to get answers to them when they have questions. Just like my colleagues from the House Republicans, Senate Democrats, Senate Republicans, to me have the same responsibility. So I answer to my colleagues there, and then I also answer to you. But whether you're a constituent or not, whether you live in the 23rd House District, frankly, if you're a retiree and lives in Arizona, being on the advisory subcommittee, I plan to review your questions, your comments as best I can. So I will let you know through emails, email blast, when there's updates. I will try to field your question. It is best if you can do a little bit of homework and see when the next meeting is, so you can see the agenda, you can see the document, say, I don't understand page 4. What the heck is this right there? Get that to me. That's what I'm here for. So I'm dedicated to keep my colleagues informed and to keep the public informed as best I can of what's going on with that advisory subcommittee, and then to do my best job within the advisory subcommittee. And as I'm going to quote Joan, you want to make sure that all possibilities are on the table and respectfully explored. That's my commitment. And then I'll work with my colleagues on that advisory subcommittee and hope and encourage each of them to do the same. And I think in that way we can do the best path forward, recognizing that we've got a $9 billion hole. So, that we've got a big challenge, but we know that, and we've faced big challenges in Delaware before, and we've successfully addressed them. And I think that's the plan. So how can we find this on YouTube? Nancy, that's a great question. So, I ended up sending it on my e-blast. Let me see if I can, let's see. Okay, so if I go and I flagged that, so let's see if I flag that. Upcoming events, that's the one. Okay, so I'm going to copy and paste into this where I want to go. I'm going to close that out. So I'm going to put a gigantic comment in here, and this is what I sent as an e-blast out on Monday. And you will see the links on YouTube. Is it going to show it to me? Hey, yeah, it's pretty long, isn't it? Does it have the whole thing? I don't want to hide it. I want to show it. Okay. I'm not sure it shows, so let's see. Let's see. Live. Quiet it up. Okay, see more. There you go. So in that comment that I posted, you can see the YouTube, both the Facebook and the YouTube ways of getting at this in the past. So I've done this. This is now the third one I've done. And I don't think I can get rid of that. Oh, that's what the hide. I can get that now. So I posted there. All these ones I post there. So it came up. Hey, excellent, Joan. Thank you. That was way too. That It made way too much sense, way too sensible. I should have thought of that, and I didn't. Thank you, Jen. So yeah, I've got a YouTube channel. Anyone can have it. Clearly, this proves that anyone can have a YouTube channel. And I took these videos out of the StreamYard is the product I use for doing these Facebook Lives. Took the video, uploaded it to YouTube, and I will do the same for this once we finish. Um, Listen, let me conclude with the following. If you're a retired Delaware State employee, you're about to become a retired state employee, you may be a family member or loved one of a retired state employee. And what we've gone through in the past 6 months has shaken your faith in our state. I get it. I get it. I want you to know that your concerns have been heard, not just by the judge, but also by the administration and also by the legislature. And we have jointly identified a path to take. I make no promises, and I think it would be bad if I did make no promises about what the outcome will be. But I can tell you that the process of this advisory subcommittee is designed to really be inclusive, consider all things fully, and to come up with the best recommendations we can. So I'm sorry for the pain and anxiety and stress that this has caused. And this is not going to be painless, but I think it will be done in a better way. So that is my expectation, and I won't say promise, but that's my goal. So I will do my best to make that happen. I hope that this is worth your time to catch, and most importantly, go Eagles. You take care.